Hello students. In this lecture we will study the occupational disorders of health professionals. The healthcare workers, they represent a substantial workforce and they are involved in providing the life support and comfort to millions of patients worldwide. However, they are themselves prone to number of health problems and during the last few years the COVID-19 has taken away the lives of many healthcare workers in all over the globe. During the first COVID wave in India, 748 doctors have lost their lives. The hospital-acquired infections they account for 99,000 deaths in India every year. Now, in order to understand the occupational hazards that are related to healthcare workers, these hazards are divided into following groups: biological hazards, physical risks, chemical hazards, ergonomic hazards, and psychosocial hazard. The biological hazards. So during the process of treatment to a patient who is suffering from communicable disease, the disease that can be spread through the respiratory droplets or airways, like tuberculosis, measles, chickenpox, mumps, influenza. So if the doctors or healthcare workers they are treating these patients without taking proper protective measures, they are susceptible to carry these infections forward, and sometimes they themselves develop these diseases. The direct contact with the patients, like the patient suffering from HIV, H1N1, influenza, or Ebola, and even during the contact with the blood of the patient, especially the patient who is suffering from the HIV and hepatitis B. And during the process of uh, analysis of some samples that are collected from the patients in diagnostic laboratories, even in even during the process of making the sera and vaccines, many healthcare workers they are susceptible to getting exposed to these different kinds of pathogens. Now the physical risks, so exposure to ionizing radiations, especially in the department, those healthcare workers that are working in the department of radiodiagnosis, radionuclide imaging, or radiotherapy. The chemical hazards, like the exposure of the healthcare worker during the administration of anti-cancer drugs, or certain allergic reactions that to certain drugs, these are the chemical hazards. The among the ergonomic hazards, the first, for example, the prolonged staining during the surgical procedures, they might lead to the healthcare worker may develop the certain diseases due to the adaptation of a particular postures. And for example, a nurse who is involved in giving the slow intravenous injection to a patient, he and or she almost bent at 90 degree at lumbosacral joint to give such type of injections, and they are prone to develop certain musculoskeletal related problems. The psychosocial hazards, prolonged duties and night shifts lead to irritability, stress, sleep disorders, and reduced alertness. The violence against the healthcare workers by the relative of the patients is also an important psychosocial hazard to the healthcare workers. You can just hear this video was circulating on the social media platform during the last 1 week. You can see here the patient doctors who is in somewhere in a ICU or in a theater, and this person is carrying some a sharp weapon and uh, trying to attack this doctor. Now the preventive measures. The personal protective measures include the proper hand hygiene, no eating, drinking, smoking in patient care area, universal precaution whenever likely to come in contact with any body fluids, high level of care while handling shops, use of lead aprons and dosimeter, especially in radiology department, surveillance and reporting of hospital-acquired infections among healthcare workers, ensuring proper handling and disposal of biomedical waste material, and immunization against hepatitis B and other infections. Adequate rotation of shift, ensuring that no healthcare care workers works continuously for more than 8 hours. Then the frequent interaction between administration and patient relative, that to minimize the conflict between a doctor and the patient or a patient's relative. So this was all about in this lecture. Have a nice time.